So welcome to this presentation titled Decoding Diabetes Endotypes, a Pathway to Precision Care. Today we'll explore how subclassifying type 2 diabetes into biologically distinct endotypes is reshaping the way we think about diagnosis, prognosis, and treatment. Rather than relying solely on glucose level, this approach focuses on the underlying pathophysiology using clinical data, biomarkers, and computational tools to identify meaningful subtypes. These endotypes help us predict complication and guide therapy more precisely. So let's dive into how this evolving framework is paving the way for a more personalized, organ protective, and biologically informed diabetes care. So diabetes isn't one disease. It's a spectrum of conditions with different underlying mechanisms. That's why endotyping matters. Instead of just looking at glucose levels, we classify patients based on pathophysiology. This approach opened the door to precision medicine where therapy is tailored to biology of each patient, leading to better outcome. To better understand diabetic heterogeneity, researchers have identified five distinct endotypes. SAID refers to severe autoimmune diabetes, often requiring early insulin. SIDD is severe insulin deficient diabetes with high risk of microvascular complication. SIRD stands out for its strong insulin resistance, linked to visceral fat, fatty liver, and cardiovascular risk. MOD is mild obesity-related diabetes, while MARD reflects mild age-related diabetes with slower progression. Now, these clusters help us move beyond glucose level towards tailored precision-based care. So SIRD or severe insulin-resistant diabetes stand out for its strong link to visceral fat and liver fat. These patients carry a higher risk of cardiovascular disease and kidney complication. Genetic studies confirm a heritable predisposition, making SIRD a high-risk endotype where precision therapies like GLP-1 receptor agonists and SGLT2 inhibitors may offer the greatest benefit. Now, on this slide, you see a table that outlines the five diabetes endotype along with their key descriptions. The table highlights how each subtype differs in pathophysiology and clinical profile, reminding us that type 2 diabetes is not a single disease, but a spectrum. Now, these figures show two ways to subclassify type 2 diabetes. On the left are simple methods using simple biomarkers or trend to define subgroups like fast or slow progressors. On the right are complex approaches combining clinical and genetic data with machine learning to identify endotypes and predict outcome. While these levels of precision may not yet be routine in standard practice, it represents an important direction for diabetes care. The shift towards biology-driven classification supports more personalized organ protective therapy and helps us move closer to truly tailored management. Now that we understand diabetes as a heterogeneous disease, let's explore how it branches into distinct endotype. Each endotype reflects a unique pathophysiology, and that's the key to unlocking precision medicine. By classifying patients more accurately, we can match them with therapies that truly fit them. Type 2 diabetes again is not a single disease but a spectrum of five endotypes, each with distinct biology and treatment needs. SID resembles type 1 and requires early insulin. SIDD reflects poor insulin secretion and high microvascular risk, managed with insulin or secretagogues. SIRD is an insulin-resistant linked to visceral fat and fatty liver, and benefit from GLP-1 receptor agonist and SGLT2 inhibitor. MOD or mode is obesity-driven, responding well to lifestyle change, an agent like metformin and GLP-1 RA. MARD is age-related, slower in progression, and best managed with individualized care. Together, these endotypes show the promise of precision medicine tailoring therapy to underlying biology. Now, as highlighted earlier, type 2 diabetes can be subdivided into 5 types, each carrying distinct risks and therapeutic priorities. Now, this framework forms the basis of precision diabetes care, where identifying a patient endotype allows us to anticipate outcomes and tailor treatment, focusing not only on glucose control but also on organ protections and complication prevention. Endotypes are classified using clinical characteristics, biomarkers, and increasingly genetic information with clustering methods and risk model guiding the process. This approach matches therapy to biology. For example, patients with SIRD, characterized by severe insulin resistance, benefit most from GLP-1 receptor agonist or SGLT2 inhibitor because of their cardiorenal protective effects. The clinical implication, therapies can be matched to the biology of high-risk endotypes, GLP-1 receptor RA, lower weight, visceral fat, and cardiovascular risk, while SGLT2 inhibitor provides robust heart and kidney protection. Identifying endotypes allow us to prioritize treatment and fit the patient's pathophysiology, the foundation of precision diabetes care. So while endotyping offers exciting potential, there are key limitations. Most studies use modest sample sizes and cross-sectional designs, which limit how broadly defining can be applied. We also don't yet know how stable these endotypes are over time. To truly validate precision medicine in diabetes, we need a longitudinal outcome trials that track real-world impact. Now to close, let's visit the key points. First, type 2 diabetes is not a single disease. It is a heterogeneous condition made up of biological distinct subtypes. These are what we call endotypes. There are 5 major endotypes: SID, SIRD, MOD, and MARD. Each offers a framework of understanding the underlying pathophysiology, the patient's risk profile, how they might respond to treatment. Identifying this endotype relies on clinical data, biomarkers, and increasingly machine learning, allowing us to cluster patients and build predictive models. This is the heart of precision medicine, tailoring therapy to biology of the disease. For example, patients with the SIRD endotype who have visceral adiposity and high cardiovascular risk may benefit most from GLP-1 receptor agonists or SGLT2 inhibitors. Ultimately, endotypes help us move from reactive care to proactive strategy, guiding prognosis, risk stratification, and organ protective treatment decision. In conclusion to precision diabetes care, as an emerging clinician, it's important to look beyond glucose numbers and focus on the biology driving diabetes. Precision care is no longer just a theory, it's a necessary shift in practice. By applying endotype-based insight, we can prioritize treatment, anticipate complications, and provide care that truly fit each patient. The future of diabetes care isn't just about control, it's about personalization. So with that, I'll end the presentation here.